We are now just 75 days away from Election Day, and there is a lot going on, so we want to jump right into it with our first guest tonight, Congresswoman Nan Hayworth, Republican representing currently the 19th District in New York, yes, soon running for re-election, or in the 18th District after redistricting that comes forward. Thank you so much for joining us. Really appreciate it. Want to start with the issue that seems to be sucking all the oxygen out of the room right now. Sure. Congressman Todd Akin, I know you know the comments that he made about legitimate rape over the weekend. You've served with the congressman for the last 2 years, or nearly 2 years in Congress. He's being portrayed as all sorts of things right now. What can you tell us about him just as a person? Well,
I don't know Todd Akin well. He seems to be a deeply religious man. I understand he has 2 daughters. I don't imagine that he intended his comments to come out as they did, but they were outrageous, they were insulting. There is no basis in medical fact for what he said. I certainly can't support his comments, and I am with those who say that he should step down from this race.
At some point yesterday, your opponent in this race, Sean Patrick Maloney, went on Twitter with a comment about your response, or lack thereof at that point, to what he wrote, or to what Congressman Akin said. Here's what he wrote. Nan Hayworth joined Steve King as one of few not to denounce Todd Akin's anti-woman statement. You had a few comments about it before. Your office released a comment during the overnight hours. Would you like to make an official statement?
Well, in fact, I have made an official statement. We were responding to some requests from journalists, and of course I also have a lot going on in terms of just being on the road with constituents, but absolutely his his comments were, as I just noted, insulting, offensive, completely unsupported by any medical evidence,
and this coming from a physician,
demeaning to women. No woman should ever be at the mercy of a man who forces himself on her, and every woman has the right to control her own reproductive destiny. You can't make it plainer than that.
In the official release from your office during the overnight, you also said that you think it should be up to the people of Missouri to determine whether Congressman Akin continues to remain a candidate for the U.S. Senate, as well as a member of the U.S. House.
Well, I said it is up to the people of Missouri,
sure,
essentially.
The de facto leader of your party right now, Mitt Romney, the presumptive nominee, he released a statement the other day, and he went a little bit further. He said Akin's comments were offensive and wrong. I think he should exit the Senate race. Do you think he should exit the Senate race? Do you think he should resign from Congress?
Well, I certainly can't support him. I think he should leave the race for the sake of, speaking as someone who would like to see a Republican who is of sound mind and policies hold that seat. I think it's a political liability, potentially. But having said all of those things, clearly it will ultimately be the decision of the voters in Missouri, the Republican voters in particular, if Congressman Akin does not voluntarily leave the race. It's a very troubling situation politically, and as someone observing the public discourse.
Now, the incident with Congressman Akin has, for better or for worse, re-injected the issue of abortion into the national dialogue right now. And we did a little digging around, trying to find some information, both about Congressman Akin and about your takes on the issue. NARAL, the biggest pro-choice group in the country, issues grades on individual members. Your grade from NARAL is a 5% out of 100%. Representative Akin's grade is a 0% out of 100%. Your 5% grade was based on a few votes that you've taken, and NARAL lists them as well. You voted to block Planned Parenthood funding twice, ban abortions in state exchanges, come up with tax penalties for private insurance plans with abortion coverage. You've got hospitals are allowed to refuse emergency abortion care. You voted for the D.C. abortion ban, the global gag rule as well, and abortion training restriction.
We took a vote on a so-called D.C. abortion bill recently, and I actually voted present because I feel that those issues should be left to the people in the District of Columbia.
And how should pro-choice voters in the 18th District view your campaign for re-election, given that score, and I'm sure you would like their votes regardless of their position on abortion?
Well, I'm staunch about taxpayer funding, and that the tax treatment of those issues has to be clear-cut. This is a deeply held issue for an awful lot of Americans who do not want to see their tax dollars go toward elective abortion. And with the passage of the 2010 health law, there were a lot of new implications for individuals and institutions in terms of their contributions toward that kind of elective procedure, with notable exceptions for rape, incest, severe threat to the life of the mother. And those also are clear-cut. But I do support conscience protections for our institutions and for American taxpayers, if you will.
Even if that leaves some women potentially not able to get an abortion, or at least to get the funding for an abortion.
I cannot imagine that there would be a circumstance in which there would be a proscription on the provision of those circumstances, of those procedures when they are legally allowed, that would not be provided for in some way. But it can't be with federal tax dollars on this sort of routine basis. There are legitimate emergency circumstances: rape, incest, life of the mother. Nobody is arguing those things, but elective procedures we can legitimately talk about as a key issue for people of conscience.
You mentioned those exemptions. Yesterday, the Republican Party Platform Committee voted up what its prescription is, or what its position is, the party's official position likely to be, when it comes to abortion. We want to put it up on the screen. We assert the sanctity of human life and affirm that the unborn child has a fundamental individual right to life which cannot be infringed. It continues by saying, we support a human life amendment to the Constitution and endorse legislation to make clear that the 14th Amendment's protections apply to unborn children. There are no exemptions in that position. That is likely to be the official policy of the Republican Party, of your party. Do you agree with that platform? And because this will have an impact on additional votes going forward as they come up.
Potentially. I don't specifically campaign on the Republican platform. I didn't in 2010 campaign on the antecedent Republican platform, which was the 2008 platform, which had, as far as I know, very similar language. I represent the citizens of the Hudson Valley, the constituents of the Hudson Valley. I feel that women have to have that right and that autonomy over their own reproduction. So the existence of a human life amendment, depending upon the terms, but as I understand it, would be counter to that individual autonomy, and I would have a problem with that.
But from my reading of that platform, it would indicate, if turned into policy, that a doctor, for example, could be prosecuted for performing an abortion.
I voted against criminal prosecution of doctors. That's just, and I think the likelihood of that happening is extremely slim. So I don't think that kind of measure would pass. And I think there are enough Republican votes against that kind of invasion, if you will. You know, we are talking about the right of people to act according to their conscience.
We're going to take a quick break here. We're going to get into what we thought this campaign was going to be about, issues like jobs and the budget and the economy. That comes up as our interview with Congresswoman Nan Hayworth continues. Keep it right here on RFL. Welcome back to RFL. I'm Andrew Whitman, in tonight for Richard French. We continue our interview now with Republican Congresswoman Nan Hayworth of New York Hudson Valley, going to be running in the 18th District this November. This is the first time I've had a chance to talk to you since the selection of Paul Ryan as the vice presidential nominee for your party. You serve in the House with Paul Ryan. Tell us a little bit about him in 30 seconds if you can.
Man of principle, a man of honor. He is courageous about bringing forth a plan that he really feels will serve the needs of our economy and of our crucial programs, Medicare and Social Security, and of future generations who are going to need jobs and opportunity, and also will want to rely on those same programs.
A lot of focus on reducing the deficit in his plans, and as you mentioned, a lot of focus on Medicare. That's been getting a lot of attention the last couple of days, and certainly there's a healthy debate going on about the plan and the future of Medicare. Critics look at some of the specifics that have been proposed by Congressman Ryan and say it could lead to cost spikes, could cut doctors and hospitals, could cut nursing homes, could lead to a two-tiered system so that healthier and wealthier patients are in private plans, or unhealthy or poorer patients are in public plans. However, the argument in favor, or one of the biggest arguments in favor of Paul Ryan's plan, is that the program could be unable to cover all seniors by as early as 2016, as late as 2024. It depends on
Absolutely.
who you talk to at any one time.
Right.
You're convinced that the Medicare voucher plan that he is presenting will still provide ample coverage for all seniors down the road, even low-income seniors?
Well, yeah, absolutely, Andrew, and it's very important, and let's resolve right here on RNN, on Richard French Live with you to get this right. It's not a voucher program. It's premium support, and there is a material difference. With a voucher program, you're getting a check, which you deploy electively, let's say. And certainly vouchers are proposed for various things, including school choice, and they may very well have a role there. But what we're talking about for Medicare is premium support. And the material difference is that with premium support, Medicare's paying the premium. Seniors choose from an array of programs. All of them will be covered. The idea, the word voucher says, gosh, some people might not be able to afford coverage. Everybody will get coverage, irrespective of their ability to pay.
Will they be able to get the coverage they want?
They will be able, the idea is that they will be able to get the coverage that they want, the coverage that they prefer. There will be, this is the Wyden-Ryan plan that was incorporated into the 2012 Path to Prosperity budget. It's a very responsible, compassionate budget. And what it says is that region by region, there'll be an auction process among insurers who will offer their plans, a so-called reverse auction. The second least expensive plan that meets the criteria that Medicare sets will be the basic plan, if you will, and premium support will be provided for every senior who chooses that plan. And by the way, this would be for seniors who are, for anybody who's under 55 right now. Right. Current seniors and those 55 and over, all of them would be able to have traditional Medicare or have the option of this premium support idea. But
there's been a lot written and a lot of criticism about this plan, in that there may be a number of seniors who want a coverage level that's higher than the reimbursement would entitle them to, or things may come up that may drive that price higher and they would have to pay out of pocket. Are those criticisms unfounded, or is there some validity to them?
Well, not to the idea that people won't get the coverage they need. The idea is that no one will have to go into financial harm because of the insurance plan that they need. There will definitely be allowances for seniors who have more serious medical conditions that require greater help. The idea is to provide the appropriate level of support for everybody who's relying on Medicare, but to do it in a way that allows consumer choice and competition among insurers region by region, allowing for local differences in the way we provide care and the way we prefer to have care and in the prevailing economic conditions within a region. But we use that choice and that competition to help us to afford to continue to provide Medicare benefits to everybody who relies on them. Because right now the alternative plan is, number one, for Medicare, for the trust fund to run out, and then there's nothing, and no alternatives have been proposed. Current law says Medicare is going to run out and we don't have anything to offer, and that will be an immediate and severe blow to seniors, and also to have the Independent Payment Advisory Board, which is going to determine reimbursements and immediately limit access to care. I
want to switch to the topic that you and I have probably spent more time talking about in all the times that I've interviewed: jobs.
Yeah.
You're coming towards the end of your first term in office, 2 years. Name for me 3 votes that you've taken that have helped create jobs.
Well, absolutely. Well, for one thing, I've voted for the Jobs Act, which did pass in March, passed the House and the Senate, was signed into law by the President, which was an immediate way to provide a boost to emerging companies who want to find investors and to grow. And it allows an easier path for them to do that from the standpoint of the many regulatory burdens that stand in the way right now. And we're already seeing an increase in the number of companies that have decided they can go public and grow and attract investment. So that's one. Two, I have voted for two bills to extend the 01 and 03 tax structures for at least another year, and then to reform the tax code, which is widely agreed that it's burdensome, it's overly complex, it's overly costly, and it is driving jobs out of the United States. It's driving enterprise out of the United States. So that's a second. In fact, that's two votes that I've taken. So that's another pair. And the third one is that I voted, and there are more, but I voted to repeal and replace the 2010 health law, which relates, of course, to Medicare as well. That's $710 billion, more than that estimated out of Medicare. But in addition, it is an impediment to hiring today, because employers, and they will tell you, they don't know what's coming up in terms of increased costs, except that they are going to be hit with mandates, penalties, and increased taxes, and that makes them not want to grow.
And I understand that point, but we've talked many times about creating jobs and about President Obama's job record or jobs record. I want to show you a couple of things. One is that jobs gained and lost. Those on the left-hand side of the screen, the numbers that of job losses under the end of President Bush's administration, and there you see positive job growth.
This is starting in 2008.
That's correct.
Yep.
But then you get positive job growth starting in March of 2010 and
but
going
if you
forward.
Look at the net loss, Andrew. If you
I understand. I understand. But
area under the curve, or over the curve and under the curve.
But I think you can make a valid argument that the graph, the left-hand portion of the graph, a lot of that is the hangover from the recession that hit in 2008 as the economy cratered out. Now,
but if you look, we've still a net loss of about
I don't think anybody's
4.2 million jobs, Andrew. We have more people unemployed and at the poverty level than ever in decades in this country.
Nobody is satisfied with the speed of the recovery. No. Nobody is. But there is a recovery that is underway, at least when it comes to jobs. The second part of this question has to do with corporate profits, because you're talking about repealing and replacing Obamacare. You've talked a lot about...
Which I never refer to as Obamacare, you know that.
Fair enough. You've also, and your party has talked a lot about trying to make the business environment better and eliminating regulations and that sort of thing. These are corporate profits in the United States. They're at an all-time record high. If they're at an all-time...
If you see from where they started in 06.
But they're at an all-time record high right now. So companies are making bigger profits than they've ever made before. You and your party are arguing that if we only make their profits bigger, they'll be able to invest and they'll be able to hire more people. Why is that a valid argument if they're already not hiring the people that we'd like them to hire while making record profits?
Well, Andrew, that's actually not what I'm saying. What I'm saying is that we need to make the environment in the United States friendly to hiring and growth. So that's the argument, is that this has become, this country, for reasons that we can fix, this country has become a place that is not conducive to investment in additional facilities for manufacturers, let's say. It's not conducive to hiring in a number of regions in the country, some more than others, because we have the highest corporate tax rates in the world, we have the highest rates on individual and small businesses in the world, and they're going to get higher if we don't act now.
But if companies are already, if corporate profits are already at a record high, how does increasing corporate profits even further and making an even more business-friendly environment inspire them to do something that they're not doing now while they're making record profits?
Andrew, this is about, again, this is about making sure that this country is a sensible place for any business, small or large, and 2/3 of jobs are created by small businesses. For any business, small or large, to actually continue to grow. And we have a climate that, between regulations that exist on the books now and those that are rapidly being written and added to, thousands of pages of new regulations between the 2010 health law and the 2010 Dodd-Frank law, we are creating a situation in which it's true, a lot of corporate investment is sitting on the sidelines. And they're looking toward the future. They're looking toward 2013 and seeing that tax cliff coming and seeing a raft of new taxes associated with implementing the 2010 health law and saying, we're not doing anything right now because it's going to be more costly to grow here and to hire here than in other places in the world. And we have to think about our customers. We have to think about how we can afford to compete in a global economy. And that's a very different situation than we faced right after World War II, which is what most people's frame of reference is.
It's an interesting debate. It's an interesting difference in perspectives. Our conversation with Congresswoman Nan Hayworth will continue in just a moment. We're going to talk Obamacare, or I'm sorry, healthcare reform, because you don't refer to it as Obamacare. That's next. Stay with us. Welcome back. If you're just joining us, we are speaking with Congresswoman Nan Hayworth, Republican representing the Hudson Valley, currently New York's 19th district, running for re-election in the redistricted 18th district. Gets a little bit confusing, but it's the lower Hudson Valley. We talked briefly in our last segment about health care reform. We know very well that you are in favor of repeal and replace. Wanted to run through just a couple of the benefits that Obamacare or health care has included in it. Kids insured through 26, preventative care, no lifetime caps on what you can get, no pre-existing condition bans. Insurers have to spend 80% on care. You see the rest of this list here. Yep. One on this list is objectionable to you. One on this list don't you like?
Well, nothing's objectionable in principle at all. You know, I want every American to have access to good health care at costs that they can afford, and to have affordable, portable health insurance. So I fully endorse the goals of the 2010 health law. I always have. But it's the wrong law. It's not the best way for us to get there. It's a very costly way for us to get there. It will take away from the kind of choice and the kind of quality, the kind of innovation, all the best things that we want every American to be able to enjoy as part of American medical care at its best. I can say that as a physician, as an eye surgeon who practiced for 16 years in Mount Kisco. You know, it's the best care in the world. We want everybody to be able to have the best care in the world.
But it's not the best care in the world for the 30 million Americans who don't have insurance and can only rely on emergency room service.
Right.
Let's
make it easier for them to get insurance.
This plan was set up as a way to keep the insurance companies in business and to not put too much of an imposition on too many participants in this, doctors, hospitals, that sort of thing.
But it will put a $2 trillion cost to administer this massive program, at least $2 trillion, Andrew, on the economy over the next 10 years. CBO, I think, has said it's at least $1.76 trillion, and we already have nearly $16 trillion worth of debt. That's more than $50,000 per man, woman, and child in this country. To add another $2 trillion of cost from Washington, and to have the federal government essentially controlling and administering our health care is something that is not going to benefit us. It's actually going to hurt us. We can do far better.
It would benefit the 30 million people who don't have insurance.
We want to benefit those 30 million people. I couldn't agree more, but there are better ways to do it. What we should have is a mechanism like what they've done in the state of Indiana with Healthy Indiana. Health savings accounts for everyone, real tort reform, real liability reform. That's a problem unique to the United States. It adds enormously to the cost of care in this country. And we need to make insurance products accessible across state lines, which right now they're not.
Your party in Congress and you as well have voted, I forget, 32, 33 times already to repeal the healthcare reform law.
Twice for full repeal, and to be followed immediately by replacement, twice to do that. Yes, there have been, with Democratic support in these various votes, there have been 31 other votes in various forms to defund certain aspects that are most wasteful in this massive program. There are a lot of so-called discretionary funds or slush funds that were allowed to be administered by the Secretary of Health and Human Services, and those are not accountable. That's not smart.
Your votes to replace, that you said followed the votes to repeal. Yeah. How are you paying for those benefits that we showed earlier that the healthcare reform system provides?
Well, the idea is to allow an affordable system that we can have based in among our citizens, and have the control between patients and their doctors and their providers. You know, we all pay for our health care, whether we pay it through our taxes to our federal and state governments, or whether we pay through our own direct contributions buying various types of insurance that we purchase ourselves, or through what our employers purchase. And then, of course, that's as customers and clients of various companies, we help pay for healthcare that way. Healthcare is always paid for by us. So I want to make sure that people get every dollar's worth of value from their health insurance that they can. Administering it through a massive Washington bureaucracy takes value away and takes dollars away from care.
But without paying for it, those benefits don't happen.
We are always going to pay for our benefits, Richard. I want to make them as least costly as possible, because we pay for them through the 2010 health law. We pay for them dearly through our taxes, and through fees, and through taxes on medical devices that are already driving medical device manufacturers out of the United States. It's a very costly way to do it. I want to make sure that we get the best care for the least cost to us, and honor all of those good goals. They're all good things that, yes, we can absolutely do, but we can do it much smarter. Health savings accounts for everyone, buy insurance products across state lines, real tort reform, problem unique to the United States, and then we can very easily provide for anybody who would find it difficult to get insurance because of pre-existing conditions. We can do this.
Congresswoman Nan Hayworth, you're taking the smart approach. You're skipping the convention next week and not tiptoeing around Hurricane Isaac. I unfortunately will be.
I wish you luck.
Thank you so much, and thank you for coming in and for speaking with us today. Really enjoyed it.
It's always a pleasure.
All right.